Rides to Community Immunity webinar. My name is Paula Hyman from the Ohio LTAP Center, and I'm going to be your technical support for today's webinar. Before we get started, just a couple housekeeping items. If you have questions throughout the presentation, please type them into the questions box, and our presenters will address your questions periodically throughout the presentation. There are documents available to download in the handout section. If for some reason you're unable to download these documents, they will be emailed at the completion of the webinar to the group. This webinar is being recorded. Providing that the recording is successful, the YouTube link is also going to be emailed out to all participants, and it'll also be uploaded to the LTAP website. I want to thank you in advance for your participation with that. And I'm going to pass things off to Ms. Juana Hostin, Urban Transit Planner with ODOT.
Good afternoon, everyone. I am Juana Hostin, the Urban Transit Coordinator for ODOT. I mainly work with the urban transit agencies in assisting them with obtaining their federal and state grants. I also have the pleasure of working with the rural transit agencies with discretionary grants, such as the State of Good Repair and the Ohio Transit Partnership Program. We also have with us today Chuck Dyer, the Administrator of the Transit Office. Happy Friday to everyone. Today is March 19th, and it is also National Backyard Day. It is National Poultry Day, National Chocolate Caramel Day, not just caramel, Chocolate Caramel Day, and National Let's Laugh Day, and also National Certified Nurses Day. So if you know a nurse, tell them how much you appreciate them. So we are here today to talk about the Rides to Community Immunity Program, the initiative by Governor DeWine and ODOT Director Jack Marchbanks to provide transportation to vaccination sites for people in Ohio. So of course, we promptly coined the acronym RCI to call this new program. This is our agenda today. I will review each of these topics and we'll stop to answer any questions after the program reporting section. But Chuck, if you see any pertinent questions, feel free to ask them as you see appropriate. And please enter your questions into the questions box. Then after that, we will provide some resources that may be helpful to you when you're developing your projects. Afterwards, I'm going to ask some transit agencies to talk about what they're doing towards this new program. And then if there are any county health departments that want to share any information, they are welcome to do that also. What this pandemic has done is it has increased our awareness of the health disparities across communities, not just in Ohio, but the country. In working for governmental entities, we tend to work in silos, particularly when it comes to funding. And I believe that everything and everyone is connected. And we have especially learned this past year, that health outcomes are affected by many factors, such as housing, education, healthcare access, and transportation. This RCI program gives us a unique opportunity to promote positive health outcomes for everyone in reaching underserved populations. So everyone should have received the RCI allocations for all 88 counties. We use the allocations based on county populations from the 2010 census, and these funds are 100% state. There are 27 urban transit agencies and 36, go back here, and 36 rural transit agencies. And together they cover 71 counties with public transportation. This leaves 17 counties with no public transit service. So we are asking those county health departments to administer these RCIA funds. These funds are available for operating assistance only. ODOT will enter into a contract with either the transit agency or the county health department for these RCI funds. As I mentioned, the importance of us working together. We want to see coordination with many local agencies in your county or counties if you cover more than one county. I also want to emphasize that with the transit agencies, that they are using federally funded vehicles and facilities to perform this transportation service. And so the Federal Transit Administration wants to ensure that while these rights to vaccination sites are important, it cannot adversely affect the provision of public transportation, particularly individuals with disabilities. These state funds are available for a 2-year period. Of course, you can see that we will allow these funds to be reimbursed for rides given back to January 1st. So if free transportation has already been provided, we will reimburse those costs with documentation. We are also aware that transit agencies have received federal funds at 100% federal. We have the CARES money, the second round of stimulus money, and now the American Rescue Plan Act funds recently announced. Now, ODOT is not telling you how to spend the RCI funds, since we know many of you may have federal funds that can be used. So you may want to use your CARES funds first and then use the RCIA money, or you can use the CARE funds with your other operating expenses. Either way, we will need to see how you are spending the federal and state RCIA funds so we can ensure we are not paying for the same ride twice. These are just some examples for the RCI funds, but it is not an exclusive list. If you want to talk to Chuck or me first and run a project idea by us, please feel free to give us a call or email and we can discuss it. These are some ineligible project types. And again, this list doesn't include all ineligible project types, but again, we can discuss projects if you have ideas. So every county is receiving an allocation. However, we are requiring an application, and I'm saying application in quotes, to receive the state funds. This application is basically asking if you're accepting this money, how you expect to spend the funds, and when do you expect to expend the funds. Now we want to see in the project description all of your coordination efforts with some real thought to your strategy. If you have stimulus funds, how do the state monies fit into your plan? We are also requiring an authorizing resolution. We understand that some of you have already started on your authorizing resolutions since we're in the beginning phase of our grant application season. If that's the case, that's fine. We will accept the authorizing resolution after April 2nd. We will just ask you to note in the application when you expect to have the resolution signed by your board or your commissioners. And as we issue the contracts to each agency, I will send out a standard invoice for the rides to community immunity to show your expenses. We're going to let you determine how you want to invoice ODOT for reimbursements. That can be monthly or quarterly, whatever fits best with your agency. We're not going to mandate, monthly or quarterly, and let you decide how you want to do that. Let's pause here for some questions. Are there any questions, Chuck?
So yes, we got two. Can RCI funds be used for expenses related to vaccination clinics at our transit facility? Can they be used for expenses related to vaccination clinic at our transit facility? These funds are designed to be used for transportation, not for actually providing the vaccine. So we're kind of reserving that these are used for transportation costs, or not only for vaccines, but for health-related transportation costs in general. So we're kind of shying away at this point from being eligible for actually for the costs associated with getting the vaccine. Second question we had, may a transit agency use the funds to use a bus in partnership with the health department as a mobile vaccine clinic? I'm going to go ahead and say yes to that question. Go ahead and submit it within your application, and that will cement the request. But in the meantime, we got questions galore trickling in, so I'm going to keep on going. Tina Burry writes, how do we submit the invoice? And the invoice will be created in an application with instructions will be emailed out. Is that correct, Juana?
Yes, since this program is so new, we are still developing the application and the invoice.
So is there going to be a sample resolution available, Juana?
We can provide a sample and email that out, and also provide it on the ODOT Transit website.
Correct. And the question from Tina Bradley, are you saying if we offer free rides to the public again, are these all these are reimbursable, or only those to vaccines? Good question. I would answer that by saying that if the intent of offering free rides is to encourage everyone to get vaccinated, and that is the intent behind it, I would say that the offering free fares is an eligible expense regardless of the trip purpose at that point. Can funds be used to purchase a vehicle? Bill Edwards. Capital. We have persuaded the use of the funds for capital assets. So we have avoided that. So funds are not going to be available for capital, just for operations. So in that case, Bill Edwards, perhaps getting purchase service for transportation services would be an option there. Question from Andre Abbey. Can Rides for Community funds be used on fuel costs for transportation service to vaccine clinics or vaccine shuttle services? Yes. Mary Haybig, we've been transporting people to vaccine locations, but we do not ask why they are going there to the site. Do we count them? If you're transporting to the vaccine clinic, I would say yes. What do you feel about that, Juana?
Yes, I would agree.
Count them. All right, questions continue to pour in. So Jeans asks, could we utilize purchase transportations for residents who live outside our service area? These funds are awarded to the county, so we are just requiring that these funds be made available to the residents within your county. So if you have a service area that is smaller than the county, by all means, yes. And if your service area is smaller than the county, we encourage you to work with your local health department to ensure that we can still provide service and access beyond your service area for the entire county. So we're looking to you to represent the entire county. So next question from Carolyn. Can the RCI resolution be grouped with our 5311 authorizing resolution? We'll look to you, Juana.
Yes, the authorizing resolution can include all of your federal and state programs, including the Rides to Community Immunity.
Okay, Susan asked, can funds be used for gas vouchers? No, we're not going to do gift cards and gas cards, but they can be used for trip vouchers. So trip So whether it's a free fare, free ride voucher, or if it's the actual cost of the transportation. We're not doing gas cards or gift cards. Clinics are popping up in different facilities. This is Barbara. How do we ensure that the rider is going for COVID vaccine and not other reasons? Again, the intent of this grant initially is to focus on vaccines, and then the secondary impact is for related or other health related trips. So that's going to be a local decision. We're not going to be so concerned on our level if they're going there for a vaccine or if they're going there for another purpose. It is eligible for both. We just ask that whatever policy and program you implement at your local level, you have a priority and focus for vaccines and however it's best to implement within your community. All right, I still got questions coming in. Oh, thank you from Barbara. That's easy. Asti Powell says, I'm sorry, I'm horrible with names. If we are designated as a mass vaccination site, which is covering 14 counties, is there an exception to only providing trips in the county? Well, I think in that case, I want to remind you that the other counties are getting funds as well. And so those other county funds can be used to provide transportation. By all means, if you're going to be coordinating some effort where you're going to be doing a shuttle or a ride that's long distance covering multiple counties, we're not going to get so concerned about which passengers were on that bus as it was going to vaccine. So we're not going to get so concerned about that, but just remember that those counties are going to have their own funds. And so maybe prioritizing and focusing on the clients and customers within your county first might be a better priority. We're not going to get so concerned and wrapped up in those details. So I hope that answers your questions, Asti. Please let me know if it does not. With that, again, the large intent of this, as Juana has said, is really to focus on getting access to vaccines. The secondary goal objective of this is related healthcare or other healthcare trips and services that are needed. Largely, that was done to ensure that if you as a county and a local feel a certain level of confidence and coordination with your local health department that people that want to get vaccinated had the opportunity and had the opportunity for a trip, these funds are going to be continued to be able to use for other health related transportation costs that may be incurred within your county until the funds are expended. Much like the Federal Transit Administration, we're not really interested in clawing back and getting these monies back. So once we award these to you, the initial priority is vaccines, 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 and the second priority is going to be health related trips. So Dean Harris says, can we set up a grant program for nonprofits and for-profit transportation agencies for reimbursement for transportation trips? Grant program makes me feel a little bit nervous, but you're always welcome to do purchase service. So if you want to put RFP or have a way for procuring and contracting with other transportation providers to help meet that need, by all means. Bill Edwards writes, can funds be used to lease a vehicle? Bill, it sounds like we may need to have a private conversation about what you're intending to do. We like to provide as much flexibility as possible. So Bill, why don't you reach out to Juana after this meeting and we can talk through your situation with you. So that's all I have for questions at this point. Again, Juana will have another opportunity for more questions. So why don't we go on a little bit further and we'll go back and I'll keep an inventory of what questions we've responded to at this point.
Okay. So we did want to provide some additional resources for everyone. We have provided the transit map and the contact list in the handouts, and that will also be emailed to you. I also wanted to show you the ODOT Transit website. And I need to Minimize it. You can-
Yeah, Juana, we're still seeing the presentation.
Okay. I'm trying to
Hit the
know.
escape key. There you go.
Okay, thank you. And Chuck, I'll let you talk about this website.
All right, sure. On the presentation is a link, and we'll share the presentation with you. And it also includes a username and password. This is just a simple exercise that the Ohio Emergency Management Agency had put together to try to map demographics that were available of potential vulnerable communities that may need access. So this is just a tool. You're not required to use it. It's just a tool available for you guys to understand where there may be targeted populations within your county that may need, that transportation may be an issue for. And so we're looking at transit dependent populations, low income, elderly, disabled, zero car, etc. So it also includes information on the left, right? Local health departments, area aging, point of contacts, and mobility manager point of contacts. So this is information that state put together with the Ohio EMA, and we just want to make it available to you as well. And it can be, you can consider it when you're working with your local health department to understand how and best to use these funds. So that's it for that.
All righty. I also wanted to give you a quick view of ODOT Transit's website, where we will put all of the information for the Rights to Community Immunity, and it's right here at the top in the banner, so you can click on this to get more information. And then also, this is the map showing all of the counties covered with public transit. And then the counties that are in white are the ones not covered by public transit.
So at this point, Juan, we had a few more questions pop in, so I'm going to go ahead and address those.
Okay.
So Debbie did ask, how do we improve rides given that on a fixed route bus is under rides community immunity? And Juan, if you don't mind hitting mute while I'm talking, I think we get a little feedback. Debbie, we're not so concerned about depicting rides on a fixed route bus. If you're offering a shuttle service or you're doing demand response paratransit or purchase service, you can get those ride numbers specifically. If you're offering free fares on a on your entire system, well, both demand response or fixed route, I think at that point it's just best to report the number of trips you provided that were free fares over the weekend for the course of whatever that may be. Yeah, you're correct. There's no way of understanding which riders are which. So use your best wisdom and judgment to report the most accurate numbers. But if you're doing free fares for a system or for a route, just report the ridership that you saw when you offered that free fare or reduced fare or whatever your approach or strategy may be. Mary Habeg was asking, you stated that we can go back to the first of the year. We've already submitted invoices for 2 months for all expenses. Do we go ahead and just invoice for what fare would have been since we are still fare free? So Mary, you know, those costs as kind of we went through earlier in the presentation, those costs are currently eligible underneath the CARES Act for providing free fares and for access to vaccines. So technically, you're already covering those costs with access to your CARES funds. If you were to use the GRF funds, it becomes a little challenging in your reporting being a rural operator because you would have to deduct those funds. They would almost be perceived as contract revenue for using these funds. So you might want to continue to doing what you've been doing with your CARES funds and just continue to draw those CARES funds down a little bit faster. And then once your CARES funds are completed, at that point you can start using the GRF funds for alternative strategies based on what the needs are at that time for either vaccines or medical appointments to match. In that case, they can be matching the Formula 5311 funds that you would normally receive. So that was a pretty big response. I hope that made sense to you and every other 5311 operator. But if you use the GRF funds while you're in place of your federal, your CARES funds, you're just going to slowly reduce the amount of CARES funds you're using. It's eligible under CARES, so our guidance and our advice to the rural operators who have access to CARES funds is to keep doing these services, maybe do a little bit more to be supportive towards these vaccines, and your current programming under the CARES funds is completely eligible for that. So yeah, I got awesome from Mary and okay explained from Howard, so I feel like that's making sense. Again, the guidance here for these rural operators is use your CARES funds, and then these GRF funds are going to be available through, Juan, if you could remind me when these are available to be used, but they can be used later.
Until December of 2022.
Yeah, so we put it in quite a while, so we have a while to get those down. And Jean asked if the application form link is available. The application is that available, Juana? The application link?
Not yet.
Okay, so that should be emailed out here rather shortly. When would you expect them to receive it, Juana?
Monday.
Yeah, so Monday we're going to be sending that out. And as Juana said with her air quotes, the application is pretty, we made it intentionally pretty easy. But largely, we're really looking for you guys to demonstrate you've done some coordination with your local health departments, whether that be the city, the county, talk with your local mobility managers, get other people involved so that it's somewhat of a coordinated effort in this approach. And a lot of you have been doing this already, and we want to thank you for doing it and encourage you to keep doing this, and you're going to have more money to continue to be helpful to your communities. Yes, I would say Howard asked a question, but do we still submit an application if we have available CARES funds to draw against in the meantime? I would go ahead and still submit that application with saying how you intend to use your CARES funds with your RCI funds. And then if that changes down the road, we can just communicate that change to us later. If there's a change in your approach. But we still want to hear your approach and how you're using either the CARES funds or in this case, the Rights Community Immunity Funds. Every transit agency is in a different position in regards to what eligible federal funds, both CRSA, CARES, and now the new funds. So everyone's in a different position, how we're using them, what's available. So it's going to be on a case-by-case situation. So I hope that explained it well. So with that, there's no further questions, and I am going to turn it back to you, Anna.
Alrighty. I did want to share one more resource with you. The National Center for Mobility Management has a good website. They are having webinars on projects like these to provide rides to vaccinations. They had one webinar on March 10th that talked about having a call center for vaccination wait lists. I know that's been an issue as more people are trying to schedule their vaccinations. They have these recorded and also the slide presentations on the website. So you're welcome to look at that. There's also a webinar coming up on March 24th that describes North Carolina DOT's program to provide rides to vaccinations similar to ODOT. So I would be interested in hearing what they're doing. And then there's one more on April 7th in Flint, Michigan. They're actually working with the transit scheduling software so that they're able to schedule rides through Flint's scheduling software. So now I would like to hear from some of your peers on what they're doing. And I'm going to ask Shorta to speak first. If Daryl and TJ Thorne could talk about their project.
Good afternoon. This is TJ. It's a pleasure to speak to everybody today, and we're excited about what we're able to do for our community. We did consult the map that we looked at earlier, and those communities where that were transit dependent, and we looked and we found there was 4 routes. But as we looked at our system, we realized that we had a lot of routes that crossed over. So what we decided to do is just go free fare system wide, and then we put a circulator route around the distribution master distribution site at Xavier University using our paratransit vehicles. And first report so far, it's gone pretty well. And it's been kind of interesting to see what kind of response we've had. But as to some of the other questions that I've heard that Chuck's read regarding, how do you know if somebody's going to the vaccination site? Well, we don't. And we are recording every rod. We have a B key that we function and just record that rod. But people may be going from one route to another route to get to the vaccination site, so we just don't know. But we felt like this is the best way to do it for our community, to make sure everybody, especially our transit dependent folks in our community, had the opportunity to get to the vaccination site.
So TJ, this is Chuck. I was just going to chime in a little bit and add a little more. So what's going on in Columbus, Cincinnati, and Cleveland, the 3 Cs, is there's an effort to do these large max vaccination sites where they're operating for 10 to 12 hours a day, and in Cleveland, almost 7 days a week for about 6 to 8 weeks long. So they're large centers where they're just processing up to 6,000 people a day. Right, so they're just getting people in and out, and it becomes a big logistic issues. And so encouraging public transit, people to take public transit. But what's important to the state, and has been important to the state, and where this funds come into play a little bit, is ensuring that there's equitable equality, I guess, when it comes to getting those vaccines. So for someone who's able to take off work, who has a car and can get there, it's not an issue to schedule and get the trip. So it was equally important working all 3 sites is understanding what the transportation options are that SORTA, CODA, or Greater Cleveland RTA was going to provide, and getting those out to the partnership communities who are going into those, let's say, disadvantaged communities, and getting those solutions to them so that they have some opportunities, right, to get over those barriers, i.e. transportation, to get to that vaccine. So, and that's where that coordination with your local health department to us is important, right, to make sure that whatever solution you're going to provide in your county, that those opportunities are shared and made available. So thank you, TJ, for your efforts down there.
This is Daryl. One of the other things we've used our health department and those avenues as well to help us get the word out. They know where the vaccination sites are. They're making sure that the information is on the news. It's in the newspaper. It's on their websites, as well as on our websites and in our buses and those things. But we're using both avenues to get the word out to people where the vaccination sites are and how to get there, and not let transit stop them from getting their vaccination.
Awesome, thank you, Cincinnati.
Thank you. And next, we would like to hear from a small urban transit system, Delaware County Transit. And while we're hearing from them, can someone from Perry County Transit also speak? And whoever is speaking, put your name into the question pile so that our organizer can unmute you. And then also, if there is a county health department on the call that would like to speak, please also put your name in the box so that we can unmute you. Denny, do you want to talk about what you're doing?
Good afternoon, everyone. Thanks, Juana. We started providing free transportation to vaccination clinics last month before the RCI money was even known about. And our population, we don't have a very large population of low income or vulnerable areas, I guess. So we've been working with our community partners, the health department, our aging department, job and family services, the sheriff's department, helpline, all of the Department of DD. So we've been working with all of the agencies and making sure that everybody knows that we're providing the free transportation. We've only got really two main providers within our county, besides the private providers. So we're working with them, and we'll help assist them with any rides that they provide, but they've not so far. And then for us, even with our free rides over this past month, when there's been a big push to get people, we've only had less than 20 that have taken advantage of the transportation. Our local agencies, the problem that they're seeing more is arranging the actual appointment to get the vaccination, and then figuring out whether the person needs to have transportation to be able to get to the appointment. And a lot of this is happening with the older population, where all of this is arranged through a third party or a proxy to be able to get that done, and then that gets a little bit confusing. So we've had to adapt things, but working with the community partners, we've been able to overcome the problems that we have with that and make sure that anybody going and get their vaccination is going to work. In addition, right now, until June, we're only operating Monday through Friday. And so for the vaccination sites that are happening for the Department of DD and for the aging, we've provided some transportation directly to those vaccination sites for those vulnerable populations. Other than that, that's about it. So I guess the big thing is working with our local partners to make sure everybody's aware, and what we can all do to work together to make sure that everybody gets one that needs one. That's it.
Excellent, Danny. And earlier when I was speaking with the mobility managers about the rollout, the vaccinations for persons who are older, it was one of the bigger challenges was getting people through the system. I think they've worked a lot of those bugs out, but you're right. It's about connecting those opportunities for transportation and coordinating with the booking the trip. That to me is going to always be a challenge. So thank you for that, Danny.
Thank you, Denny. Do we have someone from Perry County Transit?
This is Mason. This is Mason with Perry County Transit.
We got you. Go ahead, Mason. We can hear you.
Okay, sorry, I must have gotten some feedback. So we have actually been working with our health department, mobility manager, and OU to help provide free transportation for the vaccine clinics here in New Lexington. We're working with the health department to hopefully spread that around the whole county to be able to get everyone to the vaccines. We went back to full fares at the beginning of March, but we decided to help our health department out and provide the free trips along with the shuttles. We've done a couple of the clinics already. We plan to keep going with them, and we could definitely working with our community partners on this. So mobility management has been a huge help for us to kind of get everything on track, definitely.
Thank you, Mason. Do we have any county health departments who would like to share their experiences?
This is Bill Edwards from the Paulding County Health Department.
Okay.
And again, we're a very small, less than 20,000 population rural county. We don't have any transit systems at all. And we're just wondering, how this program can assist us with getting vaccination into the arms of people who are lacking transportation.
So, Bill, this is Chuck Dyer. Yeah, you're definitely in a tough situation there. However, while you may not have public transit, you do have non-emergency medical transportation and other types of human service transportation that's being provided within your county. And so reaching out to your local JFS, Medicaid, aging, DODD, they all have different contracts and providers who are currently providing transportation. So those would be excellent opportunities to do contracted services, like purchase services for transportation services. So if you identify with your local county Department of Health and customer client group community that's going to need services, you can go ahead and contract with them. If there is specific shuttle services, there are many different companies out there that are able to provide that kind of transportation as well. So I would reach out to, again, your local human service agencies that offer transportation, trying to understand who those providers are. We can talk about leasing a vehicle as well. I think in your guys' situation, it's very unique, and that'll give you ultimate flexibility, if you can get a driver for that vehicle and providing the trip. But every time that there could be liabilities with that, but it sounds like we should get together. And so just so you're aware, Bill, Brad Booth posted, well, you'd be able to set up a purchase of service with K&P Medical. They have the JFS contract with Paulding County. And then through the MCOs, the managed care organizations under Medicaid, there's 5 contracts with 3 different brokers, and those brokers are eligible as well as far as purchase services for transportation.
Okay, when you were first going over the list, you said job and family, aging, and what was the third?
JFS, DODD, Medicaid, aging. So we're going to connect you with ASTI PAL, asti.powell@chillicothe.oh.gov. She would like to get you in touch, and she's willing to help you out. So thank you. Oh wait, she said ignore. She thought she said Vinton County, Fulton County. Well, maybe you can reach out to her. She sounds like she might be able to help you out. But yes, Bill, Jobs and Family Services, which is JSF. Aging, there's a AAA. There's also DODD offers some sort of transportation opportunities, and Medicaid does as well.
Thank you.
No problem. So I want, if that's okay, if 2 more questions and a comment, if I may.
Okay.
Okay, so Howard asked, will the presentation be available for reference later? Yes, we're going to send this out. Can mobility manager funds be used to advertise this service to vaccination sites? I would say these RCI funds are available for advertisement as well, right, Juana?
I'm not sure. We could discuss it. I know you can do public service announcements and things like that for free. Let's discuss the advertising.
Okay, that's Joseph Adre. And then Bob Brzezinski had a comment that they're partnering with vaccine providers to help them schedule appointments for riders. Several have been willing, have been giving greater Dayton RTA access to their registration portals. So that's been really helpful in the Dayton area, and he just wanted to share that for everyone to hear. So that's it for the questions and comments at this time.
Okay, then I think that brings us to the conclusion of this presentation. Thank you everyone for participating, and as we move forward with this new initiative, and we will be contacting you later with applications and contracts and invoices, and look forward to working with you. Have a good afternoon.